Hi, Dr. McCarthy here. I want to welcome you to our series on fibromyalgia success secrets, fibromyalgia solutions. Many of you folks were dealing with the chronic debilitating pain all over the body, the brain fog, the achy joints, muscles, lack of energy, depression, insomnia. You know, you're looking and that you're having a hard time finding solutions in the traditional healthcare model. This series of videos that we're going to make will give you a little snippet, just a couple of minutes at a time, of information as to why the traditional healthcare approach isn't right and how our approach is completely different from anything you've ever seen before. So today, the first thing we're going to talk about is lab ranges are too broad. What we're talking about is you go to the traditional healthcare provider, they run a series of lab tests, not a comprehensive panel, just a nice short panel is what they run, and they come back and they say everything is normal. Well, if all of your lab tests are normal, why do you feel so miserable? There's got to be a reason. One of the reasons may be that the lab ranges between the highs and the lows are too broad. And I think that they should be a lot stricter. We use functional optimal ranges. So we can pick up patterns of dysfunction, patterns of metabolic body chemistry problems before it's ever picked up as a full-blown disease process in the traditional healthcare system. So if you have got tons of labs and they keep telling you that everything's normal, one of the things that we see a lot is there's a lot of overlap between folks with thyroid problems and folks that have been diagnosed with fibromyalgia. Thyroid and fibromyalgia. We've got a lot of videos that show the connection between the two. However, if you look at thyroid lab ranges, the labs will say that TSH, for example, normal is from 0.45 up to 5.0. That's a big range. And I say optimal is 1.8 to 3.0. So we can pick up conditions where maybe you are tending towards hypothyroidism. But again, you're not going to know this until you run all the proper labs. And then you got to look at your T4, T3, free T4, free T3, reverse T3, T3 uptake, thyroid antibodies, a couple of different ones. So if you have not had your labs evaluated with functional ranges, you need to call my office and tell the girls that you want to set up a time to bring your labs in, and I will give you a free 15-minute consultation to sit down and just look at your labs. And I'll tell you, look, this is what I see. Here's some patterns that are developing. And yes, there are real reasons why you're feeling the way that you do. You're taking your medications and you still feel terrible. Don't suffer another minute. Call us now. Thank you.